Welcome everyone this afternoon, this morning, this evening, wherever you are across the globe, to the Nursing Now Challenge. And we have a very special guest today, Dr. Carey McCarthy, joining us from the WHO HQ, where Carey works with the workforce team there. She plays a pivotal role in nursing workforce and in the State of the World's Nursing Report. So we are delighted to have her here because she has just arrived in Geneva ahead of the large meetings that are going on pre-World Health Assembly. And we have managed to get a little bit of her very precious time today to share with us all the news about State of the World's Nursing Report, why it's important, what's going on at the moment, and help inform us as nurses about this very important report, which is the follow-on to the first one. I will let Carey say a little bit about herself because she's more than able to do that. And we are going to have the opportunity for some questions. Please pop in the chat who you are, where you're from. And we are also joined by Amy Staley, who is one of our regional hub leads, but she also sits on our advisory board across all the regional hubs. So she's joining us from New York today. Welcome, Amy. We will also be joined by Andreas, who is also one of our colleagues from the Euro region. He will be joining us shortly, and hopefully Zipporah from African region. So they will join us and we'll put some questions to Carey once we get started. So ears ready, and let's listen to what the woman who knows everything about this, because she did such a wonderful job leading the last State of the World's Nursing Report, the first one ever, and for her sins is doing this the second time. So Carey, our future is in your hands, and over to you. I'm delighted that we've been able to have you. You're such a wonderful colleague, friend, and just such a leader in our profession. Thank you so much. The floor is yours.
Thank you, Aisha, and hello, everyone. It's a real pleasure to be with you and with the whole Nursing Now Challenge community. It's great seeing names and greetings popping up in the chat from friends around the world. So as Aisha said, I work at the WHO headquarters in the Health Workforce Department, and in that department, I'm the focal point for nursing and midwifery workforces. So looking at all things that relate to nursing midwifery and their contributions to universal health coverage. So we're going to talk today about the next State of the World's Nursing Report, as Aisha said, and I'll give you some background to that report and where we're at now and where we're going. And Aisha gave me a lot of credit for doing that, but really the State of the World's Nursing Report is really the most grassroots of all grassroots effort. It takes all the effort and collaboration and leadership at a country level in order to generate the report. So it really comes from all of you, and that's why I'm so excited to talk with you today. I'm going to share my screen and go through some slides, and then we'll have time for discussion afterwards. So I'll be sharing. Let's see. How's that? You can see them? Okay, wonderful.
Perfect, Carey.
Great.
Gorgeous.
Okay.
Lovely. Thank you.
Wonderful. So I just wanted to start off with a contextualization of our global health agenda. I think everyone's probably aware with the Agenda for Sustainable Development through 2030, and these are 17 interrelated goals. WHO is responsible for the stewardship and the leadership on Sustainable Development Goal 3, which is good health and well-being. That goal is really rooted in universal health coverage. But we as WHO see this as one of our pivotal leadership points in providing the guidance and the policy directions and evidence for those policies to help countries advance towards universal health coverage in SDG 3. So I'm going to go over just a little bit about what we do at the World Health Organization and the Global Health Workforce Department, and our perspective on contributions of health workers to UHC. And then we'll talk specifically about the nursing and midwifery workforces, where we've been, where we are now, and where we are headed. And then we can have some discussion afterwards. So everyone probably knows that WHO is the United Nations body responsible for health, and we provide that leadership and normative guidance, technical support, monitoring of health trends and emergencies, really generating that evidence so that the policy guidance that we can provide to WHO member states is sound and of the best quality possible for countries to make decisions based on. WHO is governed by two related mechanisms. One is the executive board, which is a smaller body of WHO member states, and they do things like decide on the agenda for the World Health Assembly and other certain decisions around budget and different committees. And they meet twice a year, the executive board. And the World Health Assembly is the main way that WHO member states govern for global health. And this is once a year in May. And that's when all of the health ministers come together and they have agenda, decisions and discussions to have. And that's where resolutions happen or decisions or other important negotiations. And I mentioned these two things because this level of global health governance has been sort of at a heightened stage over the last couple of years when it comes to nursing and midwifery. We've had a lot of attention and global action on nursing midwifery from this highest level of health governance. So when I talk about universal health coverage, we really think of three main components of that. And that is that everyone can access health services that they need, and that accessing those services results in an improvement in their health. The quality is such that it improves their health, and that accessing services does not cause financial hardship. So these are three pillars of universal health coverage. And so as nurses, you can imagine that this means that a country has enough health workers in the right places with the right education and skills mix and the right supportive work environments to deliver the services, to be in the right places, to deliver the services and have them be of a good quality. So this is something that WHO monitors every year through data that's reported by the member states. Universal health coverage is really the cornerstone of it is primary health care, and the same way we think about primary health care for the last 40 some years. And we all know that this is an area that nurses have a lot of contributions to primary health care and thus to universal health coverage. So how do we make sure that we can provide universal health coverage? Back in 2015, all of the WHO member states decided on a strategy specific to the health workforce, and it's the Global Strategy for Human Resources for Health, Health Workforce 2030. So that was a strategy to get us from 2016 to 2030 with a health workforce that could help us achieve universal health coverage. The current strategy for all the health workforce has 4 objectives, and they're around the areas of performance, ensuring the investments that we have enough resources going to health workers, that there's capacity in the right places, and also that we have this adequate data and evidence, because we know that's the basis for policy dialogue and decision making, and then this policy action that we're looking for. So that data is a really important piece, and we'll come back to that, because the way that countries agreed to generate that data and evidence on the health workforce is what we're utilizing for the State of the World's Nursing Report. So basically, we're really focusing on how to get enough investment in health workers' education and employment to address the shortages that we have in health workers and make sure we have those components for universal health coverage. So how we think of it is really this progression from engagement at a country level to have strong data, robust, valid country data. That data is the basis for intersectoral policy dialogue. That means bringing all of the stakeholders together, looking at the data together, agreeing on what are the challenges, what are the issues, and then making some decisions about how you want to address those challenges. And that decision making is really about where and how to invest in, say, the nursing or midwifery workforces. And when we're making those investments in the education or employment of nurses and midwives in particular, we're not just making progress and driving progress on universal health coverage, SDG 3, because most health workers are women, We are making progress on SDG 5, which is gender, SDG 4, the education of women, and also when we're investing in that work setting for health workers, we can drive progress on SDG 8, which is about decent work and inclusive growth. So really, we understand by following this data dialogue decision-making paradigm, we can actually drive progress across a number of goals in that sustainable development agenda. That's fine. So let's talk now about nursing and midwifery specifically. Since 2002, there have been some specific strategies underneath the health workforce general strategy for nursing and midwifery overall since 2002. And here are just pictures of a few of them. And these were really highlighting what some of the key issues were for nursing and midwifery in the context of the broader health workforce. Something really exciting happened at the executive board meeting in 2019, and that was that they decided to make 2020 the year of the nurse and the midwife. This was proposed by a member state, by Jamaica at the executive board meeting, that smaller board meeting I talked about that decides the agenda for the World Health Assembly. And then the decision went to the World Health Assembly in 2019 to decide to make 2020 the year of the nurse and the midwife. And that was a huge year. That year was we had these key partners, International Council of Nursing Now, funded by the Burdett Trust for Nursing. We had a lot of, every country and every region and globally, we were really engaged in focusing on nursing and midwifery. And our purpose of that year was really to not just celebrate nurses and midwives, but really expand the evidence base, because we know that evidence base is needed for policy dialogue and decision-making and that investment. So that was really the purpose. And it was a really exciting year. I know probably many of you were involved in a lot of celebrations and activities in your country. And what that year also helped do was generate the first State of the World's Nursing Report. That came up for release and issuance in 2020. And the purpose of that report was really to provide that picture of the global nursing workforce that we didn't have at such a granular level before. And then that picture was to inform the policy dialogue, to know where and how to invest in nursing workforces and to accelerate that progress along the SDGs. And I have this picture here of the WHO Director General, Dr. Tedros, and the ICN president at the time, and the WHO chief nurse, and my director of health workforce, Jim Campbell, because this was at the highest level of WHO that they decided to do the State of the World's Nursing Report for the purposes of really driving investment in nursing as a way of driving progress along the SDGs. So the first State of the World's Nursing Report gave global, regional, and country level data in a number of areas. We had a publication, and it's in at least, I think, 9 languages, if not 10 by now. And then all of the country profiles for 191 countries that provided their data. The country profile is available on the WHO website. So what did it show, the first Day of the World's Nursing Report? We showed at that time that we had 28 million nurses. We had a shortage of about 6 million nurses. You can see from the graph on the left that those distribution of nurses was very unequal. The blues are higher density per population of nurses, and the oranges and reds are the lesser density. So you can see that great inequity. And also, if you look at the tables by region, there's sometimes 10-fold difference in the regional density of nurses. We also saw that it was a highly feminized workforce, between 75 and 95% female in the different regions. And we had a number of countries that had a significant proportion of their workforce aging out in the next 10 years. We also saw that the graduation rates from countries were not going to be sufficient to fill that 6 million shortage that was projected. And it was really different by income group. And we also saw that the migration was probably playing a role in this, and the reliance on foreign-born or foreign trained nurses was very different depending on country income classification. We also looked at nursing leadership. We saw about 70 countries had that senior nursing role in the Ministry of Health for that policy, governance, stewardship, and management of the nursing workforce. And about half of the countries had a nursing leadership development program to develop that next generation of leaders. And then we look to 2030, and this map, unfortunately, of global density of nurses looks very similar to what it did in 2020, that we didn't have a lot of change when we projected the numbers out. And unfortunately, where we saw growth, there was growth, but where that growth was estimated to be was going to be 66% in middle and high income countries, which is not where we needed it most if you look at those colors on the graph. So we knew we had a lot of work to do to reach 2030. So what did the State of the World's Nursing Report achieve? We hoped it achieved that country level dialogue and decision making. And what we saw was that was catalyzed at the global level as well. What I have here is a picture of Her Royal Highness Princess Muna Al Hussein from the Kingdom of Jordan at the World Health Assembly in 2020, shortly after the report came out. She gave an address to the World Health Assembly as an invited speaker to the assembly, focusing on the State of the World's Nursing Report and nurses' contributions, especially to primary healthcare and the pandemic. And at that assembly, after that address, the assembly decided for the very first time to request WHO to develop the next iteration of the strategic directions. We had never had them involved, that it never was at a level of the World Health Assembly before. It was just a technical document that WHO developed with input of external experts. But this time they requested WHO to develop it and to bring it back. And the next year at the World Health Assembly again, the World Health Assembly adopted the global strategic directions for nursing midwifery, and they did it with a resolution, a very clear resolution, really urging states, calling on member states to implement the global strategic directions, including its monitoring mechanisms, and advance the policy priorities in the area of the strategic direction. So this is really important because this resolution, this explicit mandate from the World Health Assembly, from all of the health ministers to advance the global strategic directions, gives every country that backing, knowing that your health minister was a part of that decision to adopt the strategic directions and say, these are the policy priorities for nursing and midwifery. And your opportunity then as nursing leaders in your country is to frame your policy priorities within the 12 policy priorities of the strategic directions. And because those are the ones that are globally agreed on, there's consensus and a mandate. And if you frame your policy, your priorities in that way and say how you want to advance them in your country, that could be very powerful backing for you to advance nursing and midwifery and address the priorities you have in your country. So I'm going to go over really quickly what those policy priorities are, because they're really intended to be a resource for you to use to frame and advance your priorities. So there's 4 policy focus areas. The first is education, and there are 4 policy priorities here. And it's really about, these policy priorities are aligning the levels of education programs of nurses and midwives so that they meet the population health needs in those service delivery settings, to make sure you have enough graduates of your nurses and midwives, make sure the quality of the programs is high, meets competency-based education and accreditation standards, and that your faculty are adequately prepared to teach these types of high-quality programs and at the levels that are best suited for your health system. The second area is jobs, and this means employment of nurses and midwives. And the policy priorities here are to use your data and a health labor market framework to plan for your nursing and midwifery service deliveries and understand where you need those nurses and midwives most and how you retain them there. Another policy priority is having enough jobs, so increasing the number of nurses and midwives in your country. Another area is managing the migration, international mobility and migration of nurses and midwives, and being able to attract, recruit, and retain nurses and midwives where you need them most. The third area is leadership, and there are 2 policy priorities here. This is really about developing that senior national leadership position or positions in the ministry for that input into health policy and management of the nursing midwifery workforces. And the second one is developing that next generation of leaders. And then the last area is service delivery. The policy priorities here are really about strengthening the regulatory frameworks for nurses and midwives, and then ensuring that there is an enabling environment, an enabling service environment that nurses and midwives can work to the full scope of their education and training and regulation in interdisciplinary care settings. So those are the 12 policy priorities. And it's really something that we can see that data dialogue, decision-making progression from starting back at the year of the nurse and the midwife, of the engagement, the data from the nursing midwifery reports, the dialogue at the World Health Assembly, and that decision-making by the World Health Assembly. So we saw that at the global level, and we're really hoping that you use this opportunity to have that same progression and activities in your own country level. This is an example of a country profile from Turkey, and yeah. So now I want to talk about where we are now. We've been in the strategic direction since 2021. WHO has been working closely with governments, the regional offices, the country offices, and governments to identify what the priorities are and support countries in advancing their priorities. But we are in a very different place right now than we were when the first State of the World's Nursing Report was developed. We have any number of global health challenges, including the global pandemic that just changed the face of everything. We have a number of conflict and war, globalization, our monitoring of the universal health coverage indices showed that we have stagnation or even reversal of progress on SDG 3 in certain areas. We know there are the economic challenges that are happening right now. So we really need updated evidence that our world has changed a lot. So we know that we have to have updated data on the health workforce. We know the health workforce is crucial to being able to provide that universal health coverage and provide those public health functions and emergency protections. So this is why we need to make sure we are at a place where we have updated and accurate data. When we think about where those health workers are and what we've got right now, what we're working with, we know there are about 65 million health workers right now, of health and care workers. And that's the pie chart on the left. We have about 29 million now nurses and midwives. So of all health and care workers, nurses and midwives are about 40%, 29 million out of 65 million. The table on the right is of these only 5 occupational groups, where nurses are about 65%, 55% of those. So we also know that we have this growth in the health workforce overall. We have a growth a bit in the nursing workforce, and we have a reduction in the shortages going to 2030. We know this bit in terms of where we are now. Our shortage is projected now to be about 10 million by 2030. That's down from in 2020 was going to be about 15 million. But where this reduction is really unequitable. The Southeast Asia region will see a 3-fold decrease in their shortages, but areas of the world like Eastern Mediterranean region and the African region by 2030 will have around 70% of the shortage of health workers. So that's really unequitable. It's not a way that we can achieve UHC with these kinds of inequities. We also know there is a ton in the media about international migration and these shortages. WHO is encouraging this internet advancement and adherence and implementation of the global code of practice on the international recruitment of health workers. And there is a list of 55 countries from which recruitment is discouraged. It's not any other type of list besides that these countries have very low health indices and very low density of health workers. They're very vulnerable health systems. So there needs to be some thought and consideration and actual steps to assure the strength of the health workforce before there is active recruitment, and a number of ways that we encourage engagement with countries that are on the support and safeguard list. And this is a lot of debate coming up. These are just some of the areas that have been discussing this issue of migration and shortages as of late. So that's our kind of status of the global health workforce right now. We're also looking at the implementation of the strategic directions, how countries are implementing that. This is an area that we have to also not report on only those other aspects I mentioned, but also report on implementation and progress on the strategic directions. So these graphs show what countries have reported to us in terms of which policy priorities that they are advancing in their countries. What are the most the ones that they're focusing on in those areas of jobs, education, leadership, and service delivery. And this is part of a report that WHO has to do as the secretariat to the member states. at the 78th World Health Assembly. And that is because that's the year that the strategic directions, 2021-2025, will come to an end. So the World Health Assembly needs to make a decision on what will be the next phase, what will be the next step for the strategic directions. And we want to inform that decision and provide the WHO member states with the evidence that they need to make that key decision on governing nursing and midwifery workforces. So we know that is coming up for us, and that's a really key decision on nursing and midwifery at that global level that really impacts the work that you do at a country level. So how do we contribute to that next phase of the nursing and midwifery strategy? One way is the State of the World's Nursing Report 2025. We've got to have that data to inform the dialogue and decision making. So the objectives here are to provide the current situation on nursing and midwifery, and then allow for that planning to 2030 and beyond, so that every country has that data. We have it at a regional and global level as well. And that evidence is what's intended to support the governance decisions by all the health ministers in May 2025. So the way we're going to go about it is similar to the State of the World's Nursing 2020 in terms of the quantitative descriptions. That's all those things I showed you quickly and even more. These are reported in a globally standardized way that was agreed back in 2016 with the 2030 health workforce strategy. So there's a lot of key areas there in the quantitative descriptions. Those quantitative descriptions will also be provided in the regional pages and country profiles. And then there are some areas that are not well captured in globally standardized indicators. And so those are going to be topics that we do a more qualitative and mixed methods deep dive into. And those are things like mental health and work environment, public health and emergencies, advanced practice, research and innovation, gender, that sort of thing. So we'll have all of this sort of evidence in these areas, and then the policy directions that we think we're seeing from the evidence in terms of what are the challenges depicted and what policies will help address those challenges. So these are the indicators for the State of the World's Nursing Report. Just to give you a sense, we have these different areas about basically the jobs, the numbers, the stock and density, education, financing, working conditions, and governance. And these are ones that all countries already report on for all of their health workforce annually to WHO. And then we will pull and have these for the nursing workforce specifically for the State of the World's Nursing Report. So how we do that is this National Health Workforce Accounts, or NHWA platform. This is an online platform that every country has access to, and there's a focal point designated, usually within the Ministry of Health or sometimes in the Bureau of Statistics. But this person is responsible for understanding those globally standardized indicators and reporting them for all health occupational groups. But what we ask them to do for the State of the World's Nursing Report is to report specifically on nursing and make sure there is really robust reporting on all of those indicators for nursing. But, well, not but and, there is, because the focal point for the National Health Workforce Accounts is not necessarily a nurse. We know that we need the engagement of the nursing leadership in country to support the focal point and make sure that all that data for nursing, which can exist in any number of places, some of it's about expenditures, which might be from payroll or finance. Some of it's about migration, which might come from the Labor Department. Some of those indicators are on education, graduates, and number of seats, and those come maybe from the Ministry of Education. Some data points might be best held by the regulatory body about the number of practicing nurses and the types of nurses. So it really takes a country level effort to make sure that what is reported to WHO and shared with WHO is the full extent of the data in country on nursing, so that we can have a really accurate country depiction as well as an accurate global depiction, because we know all the ways that we're going to use this this data and this evidence. So we have the GCNMO, which is the Government Chief Nursing and Midwifery Officer in the Ministry of Health in the center there, with the NHWA focal point working hand in hand. And then we encourage that the Ministry of Health to engage very broadly throughout their country with other stakeholders who can have and contribute to that data. So here is the timeline, basically from now until the launch of the report. Right now, we're in the reporting period. We'll have this global partners meeting on nursing and midwifery next week. And we'll be looking closely at the data with partners there. We'll have the last few months of opportunity for reporting in the summer, and then we'll go to the cleaning and reporting and report writing towards the end of the year. We'll have a preliminary report to the executive board early in 2025, and they'll decide to put the SDNM decision on the calendar, on the agenda for the World Health Assembly. And we'll need to prepare those reports about SDNM progress and the state of the world's nursing data, the evidence, what are we finding? And then we'll have the launch of the the State of the World's Nursing Report, which is slated for World Health Day in 2025, underscoring the point that nurses contribute substantially to world health. And then in May, and that gives the Assembly a little bit of time to have digested the report. And then in May 2025, we'll have that likely decision or potential resolution by the WHO member states at their discretion on what they choose to do about the strategic direction. So when we want to encourage everyone to get engaged, we are thinking of these elements, these key pieces about participating in the global partners meeting, where we're going to be talking about the status of data, the methods of reporting, the gaps, the leadership roles, the deep dive topics. And then everyone has a role to play, I think, in ensuring that a country has strong data. There's different ways you can get involved through your Ministry of Health, maybe a national committee. I know Jordan had an excellent example of doing that for the State of World's Nursing 2025. Dr. Sumaya from UAE also did a great way of engaging her country nationally. There's also multi-sectoral working groups on NHWA data that people can join, and then to really try to be involved in that data dialogue decision-making in your country. So in conclusion, I think we've been talking about that a lot of global action, a lot of high-level involvement in decisions about nursing and midwifery over the past couple of years. The State of the World's Nursing Report was an exciting first, and it catalyzed a couple other firsts, including endorsement of a nursing midwifery strategy by the World Health Assembly, which hopefully provides you all with that strong backing to advance your nursing midwifery priorities in your countries. And there'll be a really important decision about whether or not that strategy is continued by the World Health Assembly in 2025. And we hope that the State of the World's Nursing Report will inform that decision-making with the evidence and findings from that report. And we also hope that report will be really useful to you in your countries in terms of how you inform your investments in nursing education, employment, working conditions, regulation, leadership, whatever it is. And so we hope you'll stay engaged in your country. Thank you very much.
Oh. Unmute myself. Thank you so much. Carey, wow, that really was a lot of information that you had to get through in a very short space of time. And I'm sure everyone will agree it was very comprehensive, very succinct, and very, very important for us to hear a lot of those messages around the background and the context, setting the scene of where this all came from, to the first State of the World's Nursing Report and what that gave us and the opportunity now that we have with this second State of the World's Nursing Report. And what we were really keen on today, and you've managed to do, Carey, is really help us understand the associated elements to this. So the strategic directions for nursing and midwifery, which has those 12 policy priorities that all of us should be taking and engaging with. That's the point of discussion that we should all do with one consistent voice. It's there. And then also the indicators around our stock and density, how that informs all our conversations around recruitment, retention, attrition, etc. looking at that data that we already have, and then how we're reporting it and the importance of that data. And back to that famous phrase from Jim about data dialogue and decision making. That we know he loves. And then the timelines and the process, because this is this is a huge piece of work. It is not to be underestimated. And I think people see these reports, but to understand the processes that are going on behind and the engagement with the different stakeholders, particularly the government chief nurses that you're trying to manage across all 6 WHO regions. I mean, it is a phenomenal task to then produce this report, and then the regulatory or the kind of the process around it with which it has to function, the World Health Assembly, all these different processes. And I think what's really useful, and we've seen it to avoid misinformation and disinformation more and more around work that goes on at WHO, is that we can actually, there is transparency here. We can see there is a process, and the work that WHO are doing, the really important work that you're doing, Carey. So thank you so much. That was absolutely wonderful. Now we have lots of questions in the chat, and we also have our panel. We have been joined, which I love, is because Andreas is actually joining from bedside, clinically in the hospital. Here he is, a real nurse, and he's taken a break from that to join us. So Andreas, thank you so much. And we also have Zipporah. So I think what I might do is, maybe because I know our colleagues in the audience, I think we're going to go to them first, if that's okay for our colleagues. There was one question from Myrna that I answered, and then because I've answered it, it had disappeared. So Myrna, I don't know if you're there, if you wanted to ask about the theory of change being important. If you are there, please unmute yourself if that's possible. Hannah, I'm not sure that is. Are we allowed to do that? Can we do that? If not, I can read the question.
Is it Myrna from Lebanon?
Probably is, Carey. Yep. Myrna. Yes. Hi, Myrna. Carey knows everyone. Myrna, please ask your question. Thank you so much. And maybe just say who you are and where you're from. Thank you.
Yes, I'm Myrna Doumet from Lebanon, and Carey and we met several times. So thank you very much for this presentation. And mainly, the theory of change is extremely important. But, and I know you might have alluded a little bit to the answer, but how can we empower nurses, mainly in low middle income countries, to be able to be an active member of this change and not only the recipient of change? Because we see our nurses are only receiving the outcome of change that is unfortunately decided by non-nursing persons or bodies. So we need to empower the nurses. And we know that WHO, you have lots of influence on ministries of health. So what can we do really on the ground, operationally, to make the nursing associations or prepare nursing leaders to be outspoken and be part of the decision-making from ground zero? Thank you.
Yeah, that's a great question, Myrna. And I know especially in countries, there are so many challenges, and there's issues of power dynamics and gender and resources and things that are really unequal. I think really the starting point is having that collaboration in countries, so that collaboration amongst the nursing leaders. So you mentioned a couple, like the nursing association and the regulatory body. I know where you have been, and the ministry is key, and education leaders. But I think that, being able to work together towards a common goal, and not working towards against each other or in smaller areas, but working together towards a common goal. And if you're working from some evidence, the data, that is why we think that if you have the data that is the country level validated data, which, for example, from the State of the World's Nursing Report and those country profiles, that is what the country reported. So I think that is something that's inarguable, that's established. And if that you have that as a basis for some policy dialogue, bringing together people, which I think it does take resources, but ideally this is something that is driven by those nursing leaders, the Ministry of Health, or perhaps even an association, or bringing people together to talk about that data and what is to be done. I think that really is the core. From WHO, we were really hoping to support that work in country, led by the Ministry of Health. So we actually put together some policy dialogue toolkits, basically how you go about those steps of convening a policy dialogue, everything from the stakeholder analysis to developing the agenda, interpreting the country profile for non-data people, or policymakers or people outside of nursing, how to have a facilitator guide and to capture those outcomes. So there are resources that exist to really support that key step of really holding that policy dialogue and bringing people together, and then sharing those outcomes of the policy dialogue. And it might be that you need to have a couple of policy dialogues. We have participant I saw from Uruguay, and they had, using their State of the World of Nursing data, they held a number of policy dialogues in their country with a number of different stakeholder groups. And eventually they developed a new national strategy for nursing. And I don't put anybody on the spot, but I saw that they had joined the call. So I think there are examples of how to really use the data, and it's not easy, but to use that data, hold the dialogue, and keep holding it until you're able to make some change and be heard. And I think there are a couple of really good country examples of that available.
Wonderful, thank you. Thank you so much. We have got many questions. I don't know if we'll get through them all, but if not, we can leave them with Carey and we can get some kind of response back to you on that. I'm going to go over to our panel now, and I'll come back to the audience questions. So I'm going to look to Amy Streely first for a question.
Hi, thank you so much. And thank you so much, Dr. McCarthy, for not only sharing the State of the World's Nursing Report, but for walking us through this whole process. I also want to wish you a happy belated Nurses Week. I know that I speak on behalf of all of my colleagues here in New York and at Nursing Now when I say that we really appreciate all that you're doing to strengthen our workforce, because truly without you and your colleagues at the WHO, our professions and patients would definitely suffer. In 2020, the largest issue faced in global nursing was the pandemic, and as discussed in the last State of the World's Nursing Report, as you mentioned today, quite a few goals that you guys are working on, specifically with SDG 3, good health and well-being is a huge focus, universal health coverage, and then I was also interested how you had mentioned the nursing shortage. So my question for you and your colleagues would be, many nurses question whether there's a nursing shortage or whether there's kind of a lack of nurses willing to live and work in unsafe conditions, specifically in these lower income countries. So do you think that the pandemic accord will help frontline workers address this pertinent issue and kind of help to strengthen and build our workforce even more so?
Yeah, thanks, Amy. Yeah, it is. It's a
big question.
Yeah, it's a lot, especially with the pandemic accord. I mean, those discussions are, as you know, ongoing and very, very intense. And it's there's a lot of back and forth about the health worker protections and everything in that accord. We did from WHO and my department during the pandemic release guidance on how to protect and support and safeguard the nursing or the health workforce in the pandemic. So some specific guidance on that. But we'll wait and see what is the result of the negotiations here. I think that the shortages that we've talked about a lot, we definitely need updated data on those shortages. I think we've had a lot of different narratives come through about shortages and a lot of different data sources. So what we need to rely on is what the member states report through the official channels, because the reporting that we use for understanding shortages is actually the same data that tells us how we're doing on universal health coverage overall. There's a SDG 3C1, which is an indicator about the number of health workers and where they are, and that really informs the access to health services. So we do see those real shortages from our validated data. I think so it'd be really important that we see those, see the updated numbers in the State of the World's Nursing Report. I think that's part of what we know when we talk about shortages, though. It is often, we can talk about them relative to certain indices and density thresholds. And that's how we did it in the State of the World's Nursing Report. And that's a threshold to be able to meet a minimum service delivery in certain areas. However, lots of countries might not be at a shortage by that calculation. However, given their own health system and their health system service delivery models and demand in their health system, they can still be experiencing a relative shortage within their health system. So there are different types of the shortages that are real. And I think a key driver of that is also migration, which you touched on, that inequity in different settings. So that's something that right now all WHO member states are asked to report on their reliance on foreign-born and foreign-trained workers. That's an effort underway that we have to report to the World Health Assembly again on the international migration status in 2025, and the World Health Assembly might make another decision about the global code of practice. So there's really key decisions coming up that next year as well.
That's really helpful. Thank you so much. And, while we do have so much to work on as a profession, I've definitely at the same time never been more hopeful for the future of the nursing profession. And I think that's, I see it in you, I see it in my colleagues here today. So thank you again for all that you're doing for us.
Oh, well done. Well said, Amy. Well said. I mean, this is difficult stuff, and it does rely on other people. That's the thing, and we are part of that. And your question was very, very useful and pertinent, Amy. I'm going to nip over to Andreas, if that's possible, because I know he is in clinical practice, so I want to make sure he gets his question into Carey. Andreas, over to you.
Well, hi, good afternoon. Well, I am in the clinical practice, but my patients are okay. I just finished the shift, but I am still at the hospital. Well, first of all, I would like to mention that I'm glad knowing that National Challenge or not the national campaign was in the first document, in the first report, and is still engaging with our friends at the WHO. So that's great, and thank you for Aisha and to all the national members. I would like to ask you about the differences in countries regarding nursing and midwifery, because sometimes, we know that there are different types of regulations regarding the curricula and the competences in every country. So how these differences we can have some difficulties solving the problem of the nursing shortage if we have different type of regulation in education and in competences.
Yeah.
And if the document or if the further strategies that will be presented in the report focus on these differences, and if will it be any kind of framework or any kind of the same regulation regarding education or regarding competencies in the clinical practice to establish some standards for all countries regarding nursing and midwifery.
Thank you. Yeah, Andres, thank you very much. So I'll just start by saying in the State of the World's Nursing Report and in the way countries report data on their nursing occupation and midwifery occupation is through this standard classification of occupation that is decided by the International Labor Organization. That is a sister agency of the it's a United Nations agency as well. So they decide all the definitions of the occupations, including health occupational groups. What we use right now were the definitions that were developed in 2008. And they were updated. A number of health occupational ones were updated slightly updated in 2012, but that's what we're working with. And in those, and it's important that we align with those because those are the standardized global indicators that are the United Nations, and it's reporting on our SDG agenda, these definitions that we use. So there's basically two types of a nurse in the globally standardized indicators. There's associate professional nurse, and that's typically like a 1 to 2 year training, often works with the supervision of another nurse. And then there is the professional nurse, which is like a 3 to 4 year degree. Typically, it's not decided by education, but 3 to 4 year, and often works more independently. So the challenge for every country in their reporting is to decide, of the various types of nursing levels in that country, how do they shake out in terms of those two categories? And maybe there's another type of nurse or nursing assistant that they have to decide whether or not that goes in the assistant professional nurse or not. Because we only, in the State of the World's Nursing Report, we only do nursing personnel, which could be professional nurse or associate professional. So this is a limitation of the existing global definitions, and the International Labor Organization is planning to update all of these, and WHO will have a role in that updating and bringing our perspective from all this global health workforce reporting. So that's how it will appear in the State of the World's Nursing Report. And I know it's a challenge for certain countries that don't have that clear definition. What we've tried to do in the strategic directions to address this, or at least give you the window or avenue to address it, is by saying that policy priority around that first one in education, which says align the education levels for nurses and midwives to match that optimal role in the health system. So that's sort of a process of identifying what roles the nurses should have in the health system and in academia, because you need leaders in academia as well. And then work backwards to what is the education that they need? What are the learning outcomes and what are the competencies to be in that education program? But that policy priority is intended to be for countries that want to revisit the levels of nursing and understand what kind of education, what kind of practice and roles nurses have. So that's really a decision at the national level to have, through your own data and dialogue decision-making about what the role should be and what the education level should be. There's not right now a standardized curricula, or that WHO is saying there should be this 4-year degree or a 3-year degree or anything like that. It's really based on what the service delivery needs are, what the role of the nurse is, and making sure that the education program provides those competencies, and the regulation obviously plays a part in making sure that they are competent to play those roles. But those are the two ways that they're approached from the global perspective: the definitions and the reporting, and then how you can leverage the SDNM to make your own changes as relevant in your country.
Fantastic. Thank you so much. Very comprehensive. And I think also just demonstrates the different elements of this and how more informed we need to be about the different elements and the parameters within which WHO work with other agencies, etc. Thank you so much. And our final question from Zipporah, and just to reassure everyone who's asked the question, we have noted all the questions, and once Carey has had her week and WHO is complete and she can breathe, we will send them and we can get a response, and we can send it out to everybody, because I know everybody has got great questions and we do value your participation. Zipporah, over to you from Africa.
I'm really grateful for this opportunity. I hope that you can hear me. Sorry, I'm out in an open field. Dr. McCarthy, thanks for taking your time to explain to us the entire process. I think my question is in regards to, can you hear me? Yes. My question is in regards to the early career nurses. I have realized, especially with the colleagues that I've interacted with in Kenya, not many know that there's an instrument like the strategic, State of the World nursing report that they can use to advocate in their communities. And so I think I'm wondering, are there any channels or avenues that us as early career nurses can get involved in the data collection process, and how then can we continue increasing awareness that they may know that these instruments are there for them to be able to create, an agenda with their community leaders, their employers, that we can contribute also to ensuring that we are adhering to the proper staffing ratios, that we are actually advocating for healthier spaces to work, and we are also advocating for other young people to join nursing and take this on as a career. Thank you very much.
Yeah, great question. I think there's a lot of different avenues for early career nurses. I think definitely the more that you are engaged, I think in, for example, like your nursing association, who maybe the leadership is sometimes more like clued into or engaged in some of the discussions at the national level, including reporting on the State of the World's Nursing Report, being part of that. Like, for example, a quad that often in a lot of countries comes together for nursing leadership, and that's the Nursing Association, the regulatory body, the Ministry of Health, and the education sector. And so, for early career nurses, for example, being involved through your education, like student groups or professional groups, those are ways to be linked into those activities. I think really groups like Nursing Now Challenge that are linked into the global agenda are really another great avenue. I think when there is that policy dialogue, for example, that hopefully, the Nursing Association and other nursing stakeholders are involved in, that there is deliberate efforts to involve early career nurses, young nurses, even nursing students as well, because that's a key voice to be heard. I think it's also, we put that in the strategic directions for nursing and midwifery. There is a specific policy priority to invest in national nursing leadership development programs. So that is something that we saw as crucial. So that's also something that the nursing advocates in country, if that's a priority for advancing nursing, you have that backing of this is a policy priority at the global level. All of the member states agree to it, and in our country, we're doing it, we're not doing it, or we could do it better, and here's how. That's something that the nursing leaders can put forward of different ways to have stronger investment in nursing leadership development. So I think through associations, through groups like Nursing Now, through, for example, policy dialogue being involved in, or through other development programs, that those are ways that early career nurses can and should really be engaged in these processes.
Lovely, thank you so much. And also for just giving Nursing Now Challenge a shout out. We are, just a reminder to everybody, 62,000 strong globally. We're over 1,000 organizations now, and across 92 countries. And I've just put in the chat, you can join as an individual, you can join as a group. We are growing very much. We are really interested in early career nurses and midwives. In fact, but we also are aware of all these other organizations, so ICN and other groups that are key stakeholders, and we enjoy working together in partnership with them, supporting them, or just being there if we can be a platform to facilitate conversation. This is about us coming together as a collective and supporting people like Carey, WHO, but also, as Carey has mentioned, really this is going to happen in country. And so the engagement with your government chief nurse, reach out to them. We saw this happen with Nursing Now, and it did work. So please do that. We're just coming to a close, and I want to make sure that we do finish on time and release Carey as she carries on her important work. And I just want to say thank you so much. We have had so many people comment in the Q&A, finding this very informative. Many people asking, can they have access to this? But we have recorded it, so you will be able to watch this again. Please share it. Please encourage people to get involved. Find out, is your data being reported? I think there was someone in there saying, are the Bahamas, the data, is that being reported? So you can find out, you can go and ask and see, is your data being reported? How can you help? If you're a student in a university, we're interested in that. We're interested in academics and nurses who are out in clinical practice. It's all there for you, but it requires you to take some action also, because we are here. Carey, thank you so much for your time. It was a wonderful, eloquent, very thorough presentation. And thank you also to the panel and to the many colleagues who joined us today. We had Raweda with us again, we had Elizabeth Adams, and we have got some great colleagues and friends who have worked together over many years to support the agenda. And we wish you all the best next week with colleagues and everything that you do, Carey. And thank you so much for being with us today. And we are supporting you. Please ask us if we can do anything to help, and have a wonderful day, everyone. Thank you to you all from across the world. Take care.
Thank you, Aisha. Thank you, Amy. Thanks, Andres and Zafara.
Thank you.
Bye. Thanks.
Bye. Bye, Andreas.